Dr. Ed Zimmerman, Aesthetic Revolution Las Vegas. Welcome back to our next segment of Aesthetic Revolution, the podcast, where we talk about aesthetic issues from forehead to feet with my hostess, Staci Taylor Zimmerman, our director of aesthetics. Keeps me from going down rabbit holes and things. And today's topic is kind of an interesting one. Body piercings. You know, piercings from, well, all over that maybe somebody has gotten tired of, or maybe there's been some trauma where the piercing got pulled through and the hole is bigger than they want, and how we can deal with those in the office setting, because they're small repair procedures where we can fix those things.
Thank goodness.
Yeah. So, you know, if you're having some regret or doubt about a piercing that you got earlier in life, you can talk to your friendly neighborhood aesthetic surgeon and find out what they can do. What we usually do is evaluate how the piercing was done and how any damage was done, where the piercing got pulled through the tissue to make the hole bigger. Has the piercing been out of the hole for a while? Have things shrunk down? Is there symmetry? Are there uneven levels between the edges of the piercing? Things like that. Once we figure out the method of destruction, then we can figure out how to put it back together again. And that's often done in our procedure room under just a little bit of a local anesthetic. So we don't need to go to the OR. We have a fully accredited operating room where we do our bigger procedures, and we're 5,300 square foot of space where we do a lot of fun laser and light and radio frequency and electromagnetic procedures, filler and toxins and all that. But this is something that I've been doing for, 25 years more. First with cold steel, so little baby 10 blades and 11 blades and things like that. But now we use a CO2 laser, and we have a special CO2 laser whose energy is absorbed by anything that contains water. Skin contains water, so we can carefully numb something up, mark it first so that we don't alter the topography, and then very carefully de-epithelialize tissue or change the contours of the tissue of the opposing edges. Now, if someone just has a piercing in an ear or a nose or someplace else where it's been pulled through, or there's a hole, or there's a little straight line up and down, we may be able to de-epithelialize the piercing part and bring it back together with a couple of sutures that stay in for about a week, maybe 10 days. The sutures are as fine as your eyelashes, and the results are generally pretty good. You'll get a little linear scar, just like you would for any kind of excision. We'll talk about lumps and bumps and things later. But it's a nice trade from the boondoggle that you've got hanging off your face that everybody notices and goes, "Ooh, what happened to you?" So, you know, kind of interesting.
A lot of younger adults have these gauges, these big round, piercings, and they're wanting to have those fixed. Explain kind of how you do that. It's the same method, but you've got a bigger hole that you need to repair than just a regular piercing that's pulled through.
And we see that a lot in people who are entering the next phase of their life. So they're going into the military or metro or whatever, and they can't have visible body jewelry like that. They may not be able to have visible tattoos, but that's a whole nother segment that we'll talk about because we love doing tattoo removal. But yeah, if things are stretched out of shape, I have to figure out how much of the redundant tissue to cut off to bring things together and sew them into what looks like an earlobe again, or a brow, or a philtrum, or a lip. And those are a little more challenging. I like the jigsaw puzzle way things come together. So there's a lot more planning that goes into correcting a gauge and make it look like, someone had a scratch on their earlobe, but now they have a new earlobe. The earlobe is kind of an interesting critter. Some earlobes come and attach to the jawline, and they actually go straight down. They look like a satyr or a pixie ear. Most earlobes are better off if they come in at roughly a 90-degree angle to where they attach to the side of the face. That's certainly how we try to do it when we do upper neck, lower face lifts. And, whether you've got a long dangly earlobe or an earlobe that comes straight down, trying to make the lobes, we'll decline that call, trying to make the lobes so that they're relatively symmetric. The gift of earlobes is you can't generally see both of them at the same time. So people have to turn one side or turn the other side, you don't generally see them. But if they're wildly asymmetric, people are going to notice. And we see the same thing with cauliflower ears and other ear issues that, that's a whole different procedure where we're scoring cartilage and pinning them back against the head, and you get to wear big old earmuffs for about 10 days to protect them from getting pulled out from where they should sit down. But earlobe repairs, especially for gauges, for pull-through earrings, or things like that, generally take under an hour in the office with local anesthetic and some nice music, and chill out, and you have a brand new earlobe when you're done. The sutures stay in 7 to 10, maybe 14 days, depending on the person and how much sewing we have to do. And getting the edges of the skin, because typically the tissue close to the body is a little bit thinner. The tissue of the earlobe further out is a little bit thicker. So you have that area in between where the damage occurred, and you have to manage to taper the thicker to the thinner. So that involves some nifty bivalving, where you can make a little incision here, a little incision here. This extends a little bit, this comes down a little bit, the two come together, and they're just about the same level instead of having a step. So that's one of the arts of earlobe that we've learned over the years, because otherwise it's very visible, and that's not cool. Now, for people who've had a repair elsewhere and they come in and they've got a little step, but the repair is solid, we can, depending on their skin type, if they have lighter skin generally, or they heal well, or their hair is going to be covering their earlobe, we can actually use a CO2 laser to carefully vaporize the elevated tissue. And that leaves a little bit of a visible healing area, but generally that heals pretty well together. And we do that for both the front and the back of the earlobe and the edge. Because another thing we see that happens is as we heal, we have the contraction of healing. It's part of the inflammatory part of normal healing. And you can get an earlobe that's scalloped. So you have to plan ahead and bring the outer edges of the tissues together and make them pucker outwards a little bit, so that when you release your sutures and they heal, they pull back in and they're just straight or just flat. So a lot of little cool surgical techniques go into the repair of an earlobe. Brows are kind of similar, but generally, unless they've had a pull through, the brow is more of a puncture. And so what we'll do is very carefully deepithelialize the hole, because you can't sew skin to skin and expect it to stay. And we'll deepithelialize the hole, take any hypertrophic healing out of the way, or sometimes we'll use something as simple as a 2mm punch and just use the laser for cauterizing the edges so we don't get bleeding, and then close with a little linear closure that goes the same direction, if we can, as the hair follicles in the brow, so that it stands out less. So you've got one at the top, one at the bottom. And that's not too bad. That's kind of fun. As we move down through facial piercings, and of course we've seen them in cheeks and things like that, if you take one of these little wine screw cork deals that goes into a cheek or something like that, the only way to get rid of that is to literally take a little dermal punch and take that whole thing out, and then close it with 2 or 3 little hair diameter sutures. And those work pretty well. We try to put the linear scar along Langer's lines, along the direction of the lines that your face makes, just so you can see the lines in your palm. You can see the lines in any part of the face. So under magnification and good lighting, we can see that. And then we move down a little bit to lips and philtrums. And philtrums are kind of cool because we do a number of subnasal lifts as part of our aesthetic evaluation for the face. When we're looking at the face and we're dividing it into thirds, upper third, middle third, that's the true third, and lower third, sometimes we notice that over the years, because dentition has pulled back, or the upper lip and lower, but upper in particular, has gotten thinner, that the lip tends to hang down further. And it gets thinner, it hangs down, and it gets what we call a duckbill deformity. And so we don't see the philtral pillars. The lip has gone from a nice, luscious, generally estrogen-ized lip, so you have nice, luscious lips like yours. And it's gone to sort of a very thin Betty Boop lip. And you can put fillers in the lips, but if you put filler in just the lip and not the tissue above or below it, you look ducky. And frankly, nobody wants to look ducky. So part of fixing a out of proportion lip, because normally this area here from the Cupid's bow to the columella below the nose, or right in the middle of the nose, should be 13 to 15 millimeters in most women. Guys a little bit longer. When it gets to be longer than that, we either have to reinflate the tissue or do what we call a subnasal lift. And so we numb this up. We use the CO2 laser with its 0.25 millimeter spot, so it's like a laser scalpel, to very carefully make a little Frito Bandito mustache. And we take out just a little bit of tissue and we hide the incision in the crevice here on either side of the nasal ala, inside or at the edge of the nose in the nostril, and comes just across at the base of the columella. So it should be pretty invisible when it's put together. And you actually take the tissue out all the way down to orbicularis oris, so the muscle that goes around the mouth that lets you go, ooh, that's a pretty strong muscle. We want to leave that muscle alone, but the tissue we can take and we can bevel the edges so that the edges pull up together and make a pretty inconspicuous scar. Back in the old days, they used to pair that with a little triangle in the corner of the lips to try to get a little more of the pink of the lateral lip to show. I think that's a pretty visible incision. People meet you, they look in your eyes, they scan down to your mouth and chin, they come back to your eyes, but they catch these little white marks that some people get from that. So there, I like to use filler. And whether we use a long-acting filler like what I've had in my cheeks for the past 8 years, or a short-acting to make sure that it's very supple, it moves nicely, that would be a consideration. But we use the long-lasting fillers in this above the lip area, not in the lip per se, but above the lip, and sometimes in the corners just to get rid of that trout pout, that downturn.
So you're saying with piercings around the mouth, you add filler as well as repairing?
Yeah, very often, because the piercing generally went in much earlier in life, and by the time people have gotten around to taking it out, the piercing is kind of dangling in a funnel-shaped hole, and the volume loss is part of the issue. So we can make the hole smaller by inflating the tissue around it. We've still got to de-epithelialize the hole, but it's a couple of different things that come together to make it the best cosmetic outcome. It's kind of like going for a meal and you have a knife, a fork, and a spoon. You could do okay with any one of those, but it's a better meal with all three available. So that's kind of an interesting thing. And similarly with lips, lips and brows are kind of similar in terms of how we treat them, except we have to be very careful how we line up the vermilion margin and that we don't get compression during the repair and things like that. So, or if it's just a screw in, that's a little easier because we can do a punch and leave a little linear repair that generally becomes sort of hypopigmented or occasionally a little bit darker depending on the skin type. And that works pretty well. I think we should talk about cauliflower ears at some point, but that's a whole different discussion because that's not an easy repair. That's going to the operating room repair.
Let's talk about belly buttons and then below the belt, because we see a lot of that as well.
Or before we get to belly buttons, how about nipple piercings?
Yeah.
So, there are a number of nipple piercings that were not as successful over time as people wanted them to be, whether it was a barbell or a ring or whatever. And the nipple has become a bifid nipple where it opens up and has two separate edges. It's easy enough to de-epithelialize the two edges, bring them together, and have a little linear scar that looks like it's part of the normal nipple. So that's kind of fun. You can do something similarly with just the hole from that, although very often, if you take the jewelry out, the hole closes pretty much on its own. So if it's not too visible, we don't have to do anything. On the other hand, belly buttons. Dude, what's been done to belly buttons above and below the belly buttons over time is just not pretty. Because what happens as we age is our spine fights gravity and the spine gets shorter. And when the spine gets shorter, the tissue around the torso has no place to go, so it flops down on itself. So unless you can pull the tissue up or pull the tissue down or remove the extra tissue, what was a nice, happy, perky belly button that had a cool little gem hiding inside it when you were younger becomes a grumpy face with the gem hanging out, flopping on the side. And
not pretty.
Not pretty, and often it gets torn out. So if we're doing an abdominoplasty or we're doing lipo and then torso skin excision and things like that, we can enhance that belly button by taking a little crescent of skin pull the inner part of the belly button out a little bit, remove the extra skin around the top of the belly button, or sometimes the bottom, rarely on the sides. They seem to go more on the top and then on the bottom second. And we can make that belly button a little happier. But if the belly button is really hanging low, the belly button should be located within an inch up or down of the top of the hip bones. Of course, the top of the hip bones are getting closer to the bottom of the rib bones the older we get. But what we certainly see, especially in gals who've had babies or guys who've gotten heavier, is the belly button rotates down. And even if you do the repair, it's still pointing the wrong way. So you have to have that discussion with people. Is this worth doing a repair on? Because what you really need is to literally take the belly button, move it up, and get rid of that insertion site while you're at it. And we do a lot of that when we're doing torso lipo skin excision rectus repair for a total abdominoplasty, but that's all done in the OR when we're doing the big repairs. The little repairs we can do, again, with the CO2 laser, so very carefully move them around.
Someone that's younger that doesn't have a lot of skin laxity, but just doesn't want to have that belly button piercing anymore, you would do it just as if you were doing an earlobe.
Yeah, the tissue's not far different, interestingly enough. And we want to hide the incision, if possible, just inside the lip of the belly button. So we don't want it on the outside. So we can take some of that extra outside skin and clean off the underside of it and get it to pull down into the belly button so that the scar that you make during the repair, because you're cutting out a crescent of tissue that contains the tube where the piercing went. So you take all that out, and we try to make that invisible as much as possible. Occasionally, I've got to do a little inverted T because the piercing went in so high. Not all piercing people are equal when they put in their piercing. Sometimes they go too high. And in order to get that incision site out, you've either got to have an up and down linear scar or just an inverted T where the bottom of the T is inside the belly button, but the stem of the T goes up to include the outside part of the piercing. And then we go down lower. And this has been an interesting area because the same way that skin stretches in a face or a nipple or a belly button, it can stretch for men and women down below. So piercings in the clitoral hood, sometimes that hood gets pulled down over time. And when we do a labiaplasty, one of the things, whether it's a labia minoroplasty or a labia majoroplasty or both, is we ask whether the gal would like to have a little bit of the hood removed in order to give the clitoris a little more exposure, visibility, sensitivity and such. But jewelry in that area can pull that hood down so the clitoris is entirely covered. Hopefully they didn't pierce the clitoris because that can damage the sensory nerves that go through there. And so sometimes you've got to repair the outside of the clitoris. The other thing we see is that in some gals, that hood never separated embryologically. It never separated so it could pull back and reveal the clitoris during relations. And so those poor gals are going around with decreased sensation and sometimes decreased ability to orgasm. So a little bit of estrogen cream or surgically lysing that tissue so now that it can move up, we can cut off the edge, throw that little piece of tissue away and get something that looks more like a normal, happy clitoral hood. Occasionally we see piercings down below at the entrance of the vagina. Again, generally if you take those out, unless there's something that's ripped or a gauge or something, you just take them out and they close on their own and they're not a big deal because they're not as visible. On guys, on the other hand, guys do all kinds of crazy things to their manhood. And we've certainly seen guys who've come in with a series of pins across generally the top of the penis, where they have, Prince Albert, Prince Rupert, pick a prince. They've either put piercings across the top or they put a piercing through the tip, through the urethra. Now the ones that are on top, again, generally you can take those out. The skin is pretty stretchy. If they really object to the little pigmented areas where the piercing went through the skin, we can use a pigment removing laser to treat that a little bit, but often those just get left alone. Or we can, if they're close enough together, remove a little bit of skin with a linear incision and just a little elliptical incision to remove both ends and then close that together so it becomes linear and looks like a normal fold coming across the skin that surrounds the hydraulics of the penis. On the other hand, when they get a ring and they put it through the opening of the urethra and then down to the underside of the meatus on the gland's penis, that creates a whole different difficulty, because literally to take that out, they have to have an indwelling catheter for a week to 2 while that hole from the inside of the urethra has an opportunity to close. So you repair it, but if you put urine through it, it's just going to ruin the repair on the inside of the urethra. So you put a catheter down so that you don't have the urine of low pH damaging your repair, and so you repair the inside, deepithelialize it, and remove the outside. But you got to have that catheter while you're doing that. So generally, we'll send that out to a urologist.
Are they trying to just put that piercing through their urethra, or is...
We've asked that question, and but that seems to be they feel that they increase their sexual pleasure by having a ring that goes through the tip of the penis, so that while they're thrusting, it's rotating back and forth. And Now, the other place we've seen it is along the median raphe, towards the top of the scrotum as it connects to the shaft of the penis. That's another place that tends to get barbell insertions. And again, if you take those out, it's not terribly visible. The shaft of the penis generally hangs down when the penis detumesces, and when it's up, there's so many folds in the scrotum that it's not generally visible. So that's not much of a problem. They just take those out.
Okay.
And, we see piercings elsewhere, down below, but those are the big ones. So that's sort of the forehead to feet version of piercing repairs, that if you go to someone who's got, pretty expensive CO2 laser, I don't know what they cost these days, somewhere north of $100,000 to get a good super pulse or ultra pulse CO2 laser that you can actually do surgery with. We use ours to do upper blepharoplasties, brow pexies, transconjunctival lower blepharoplasties, and it's got enough power to actually do facelifts. So, but being able to do lumps and bumps and things like that, where something that controls the amount of bleeding, improves healing, seals the nerve endings, is head and shoulders above what we can do with cold steel. Mm-hmm. And I think we get a better cosmetic result overall. But many people, and me, for a number of years before we got our first CO2 laser back in the 90s, we used cold steel. That's what we had. That's what we used. We got reasonable results. In general, I think these are better results, and they're more quick, and they're less messy, because you get hardly any bleeding with the CO2 laser. It literally sterilizes and cauterizes everything it touches while it's doing it. So it makes me a better surgeon.
I would say it's your right hand. You use it for everything.
Yep. Just about every day we're using that CO2 laser for something.
Yeah. Lots
of lumps and bumps, lots of benign lesions that are elevated that get vaporized down smooth, all kinds of fun stuff. But that's another segment where we'll talk about pigmented lesions and vascular lesions and benign elevated lesions and stuff like that. So I think that we've probably covered most of the piercings that we need to cover. But if you have questions, if you've got a piercing from someplace else, call. We love answering questions, but you can subscribe to wherever you subscribe to your podcasts. And if you want to see us in person as we're talking, go to YouTube, and it's at the Dick Doc, DICKDOC. All right, I'll get that eventually.
Or type in the Dick Doc or type in Dr. Zimmerman. All will pull him up in the YouTube channel. Yep.
So anyway, thanks for watching, and we'll come back to you with the next episode of Aesthetic Revolution, the podcast. We'll be talking about more fun stuff, aesthetic procedures from forehead to feet. Thanks for listening.